Approximately 20 million people in the U.S. have diabetes, and 1/3 of those are unaware they have the disease. We went to Good Samaritan Hospital in Los Angeles and spoke with Dr. David Boyer. We asked him how diabetes affects the eyes.
Well, for the most part, diabetes is one of the leading causes of blindness. It affects the eyes in many ways. One of the most common way is with causing changes in the retina. There are two forms of changes. One is called non-proliferative diabetic retinopathy, and the other is called proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy means that the blood vessels that we're born with that nourish the retina begin to leak fluid, they begin to leak serum and blood products, and this causes swelling of the retina. The swelling of the retina actually can diminish the vision. Proliferative retinopathy implies that you are developing abnormal blood vessels, and this is usually in response to a poor blood supply that diabetes causes. Most of the visual loss is secondary to what we call diabetic macular edema, which is a leakage of serum, blood products, lipids into the center foveal area that has to do with your ability to read, watch television, and to see people's faces clearly. Diabetes forms scar tissue, and these abnormal blood vessels that are forming are very fragile, and they can actually pull the retina off. And in that case, you have to do a surgery to relieve all the traction to try to take the blood vessels off the surface of the retina and to cauterize it and reattach the retina so the patient can see. Non-proliferative retinopathy, for the most part, is a non-surgical disease except for laser and injections.
How important is getting your diabetes under control?
If you don't get your diabetes under control, the systemic factors, the blood sugar, the blood pressure, and the lipids, you're going to have continued damage not only to your eyes but to the rest of your body, to your kidneys and to the nerves that supply the sensory input to your legs. So you'll end up with neuropathy, kidney problems, and other changes that can occur. It's been shown in numerous studies that if you can get your blood sugar under excellent control for long periods of time, up to 26 months, that you can actually get a reversal of a lot of the diabetic changes. So it's not inevitable that it will continue to worsen. Blood pressure is also very important, and control of your lipids. So it is extremely important that you continue with your internist or your diabetologist or endocrinologist who's going to be taking care of your diabetes to get your A1C hemoglobin, or a measure of average blood sugar over a 3-month period, into as low a range as you can safely. And by doing this over a long period of time, you can actually improve your retinopathy.
Dr. Boyer tells us about the new advances for diabetes.
Well, actually, in the last several months, there's been a major breakthrough in our treatment of diabetic retinopathy. Clinical trials and a stage 3 were able to show a marked improvement in the vision in patients that received ranibizumab treatment, or Lucentis is the trade name, every month for over a 3-year period. And they were able to actually get an improvement to 36 to 40% of the patients actually getting 3 lines of improvement, which is much, much higher than we ever had with laser, which was in the range of 3 to 15% 3-line gainers. So this is really a new paradigm for ophthalmologists and for patients. We are able to treat patients without causing any damage to the central area, because laser is destructive. Even though it does work, it is somewhat destructive. So we are limited how close we can get to the center when we treat. With this, we're able to treat, and if we can treat aggressively, we'll be able to save a lot more patients from going blind.